Hello, welcome to another video. So today we are going to demonstrate how to do a perfect cannulation. So here we have our cannulation tray. We have multiple varieties of our cannulas, and we have a sanitizer, extension cable, couple of teragram, gauze pieces. So before doing cannulation, we have to keep in mind some techniques. First thing is we need to be very confident. So before doing cannulation, if you have lack of confidence, you can't able to do a perfect cannulation. The second step is patient surrounding, you have to keep it very good lighting. The lack of lighting, you can't able to see in the vein flow. The third step, you need to give a good pressure. By using this tourniquet, you can give a good pressure. By that pressure, easily you can access the vein. And also the very important part is we need to explain to the patient that what we are going to do as a cannulation. What is the importance of cannulation? We have to aware to the patient. So as you can see, here we applied the tourniquet for getting the better pressure. So here you can see the vein pressure. Okay. So from the beginning of the video, I have shared you that importance of lightning. So if we having the better lightning and better pressure means easily we can able to find out the vein. So the next step is we need to sanitize the part of doing the cannulation. So here now going to insert the 20 number cannula. This cannula is usually we are using for the adult cannulation. This is comes in pink color. I'm not going to explain about the parts of cannula, that also you can check it from the Google as well. So here I am showing you, this is the needle and followed by the catheter, plastic catheter. So the needle part only we will insert to the vein. लंबी श्वास ले लो. The first thing, as soon as possible you need to remove the tourniquet. If you are not removing the tourniquet, the bulging, either with the swelling, it can cause. The backflow has came. So now you need to slowly remove the needle. At the same time, slowly you need to insert the catheter.
मावशी, ते काय म्हणते बघा ना पेशंट. बेल कोणाची वाजते ते पण बघा. तिथे काउंटर बसून देतो.